Hello, everybody. I'm Sandra Arevalo once again from Montefiore Nyack Hospital presenting Community Chats. And today we're going to be talking about eating disorders. And you see my face, and this is because eating disorders are unfortunately prevalent in our community, and it's not so much that we know about them, but they can get very serious with very serious consequences. So today we want to educate the public on what eating disorders are, how they manifest, and especially what can we do to help someone that we think might be going through one of those disorders. So to talk to us about eating disorders, we have a new organization in the community that is Montenito. So now they have opened a new home here in our community, and I'm very happy to introduce them to you guys. So they're Sarah, Emily, and Noel, and now they're gonna tell us what they do and what Montenito is before we start talking about eating disorders. Thank you so much for being here and welcome. Thank you for accepting this invitation.
Thank you. Thank you, Sandra. I'll start and then I'm going to kick it off to Noelle and Emily. I'm Sarah Hagens. I'm the outreach manager for Montanito and all of our programming. Um, Emily and Noelle are our clinical directors at each of our sites in Rockland, which they'll talk about in a little bit more detail. And we are definitely going to go into a lot more detail about what Montanito does and who we are. But as a high level, just to start us off, Montanito is an eating disorder treatment program with higher levels of care. So that would include inpatient, residential, PHP, and IOP. PHP and IOP includes day treatment, which is a higher level of care than your typical once-a-week therapy. We'll go into more detail for that as well in a little bit too. But my role is to be the liaison between our programs and the community. So I'm excited to be here to just share more and be a face that if you need anything in the future, you can certainly reach out to me. I'll have my contact information at the end of this presentation. Noelle and Emily, do you want to share too?
Thank you,
Sure.
Sarah.
Thank you, Sarah. Hi, everyone. My name is Noelle. I am the clinical director of our Clementine West Nyack site. My site specifically is different from Emily's site, which she'll talk about. At the West Nyack site, we are an adolescent program. So we offer residential treatment for adolescent female identifying individuals, ages 13 to 17. Oh, sorry, did I freeze? I apologize. Ages 13 to 17. We are a 14-bed house, so we have up to 14 clients at a time. And we're going to talk more about eating disorders and, what that looks like. I'll speak more to kind of what we see with adolescents versus adults, but I'll let Emily go now.
Yeah, thanks, Noelle. So happy to be here with all of you. As we said, my name is Emily Sigmund. I'm the clinical director at the facility in New City, another residential site. We're called Montanito Rockland because we were the first one here in Rockland before we anticipated bringing in an adolescent site as well. So I'm super excited that we have that offering as well now at our site. We are also a 14-bed facility and we service all genders, and we are also servicing 18 and up. So really we do have that variety of clients that are coming in with varying different types of eating disorders, as well as just ages, demographics, identity factors. Yeah, and I think that it's pretty important that we've got this in the Rockland County. I think that we've had some sites in other areas. And I think that just, as Sandra was sharing at the beginning of this meeting, like eating disorders are really prevalent, and they're really increasingly prevalent in the society that we live in and in our culture. And so recognizing the signs and understanding how to support our loved ones, or even someone that might come into our facility. I'm not sure, who might be on the call. You could be a family member or a loved one, or you could be another provider, and trying to figure out how to get people connected to the services that we offer. So really excited to be here. I've been with Montanito since our site opened in the New City location about 2.5 years ago. So I'm happy to be a resource to anyone with any questions that they might have at the end of this as well.
Thank you so much for the introductions. And I think that one of the things why I do community chats is because I always have a lot of questions. So let me ask you something before we get started. Monte Nido is an unusual and at the same time a very nice name. Does it have a meaning, Monte Nido? And also my second question is what age is your oldest patient?
Sarah, maybe you can correct me if you want to add to this, but the name Montanito, I believe it means like mountain's nest, which one of our original sites that opened in California was up on a mountain and is meant to be symbolic of a site for like healing and, just being able to step away from the busyness of life and to be able to be in a space that provides focused support for healing and recovery. And so I believe, unless you want to add more to that, I'm pretty sure that that's kind of like the overview gist of our name. And then the oldest clients that, specifically in my site that we've worked with, I think we've had clients in their later 60s. But we do not have like a cap on that for clients. If they're deemed appropriate and needing our services, like we're 18 and over.
Thank you so much. Yeah, that makes sense because that's exactly what it means in Spanish, at least, mountain, nido, nest. So very beautiful. So whenever you're ready for your presentation, wait a minute, will there be a copy of the presentation available after? Yes, you're gonna be able to see the recording actually in YouTube. So I will send you the link as soon as we put it up. So yes.
And then additionally, we can't send the exact PowerPoint, but I can absolutely send information about us and an overview of like what is in the PowerPoint, signs and symptoms and that sort of stuff that's really helpful. So absolutely.
Very good. Thank you so much. Take it away.
Okay, so I'll go ahead and get us started. Really just kind of providing this brief overview, a little bit of the importance of, support with eating disorders and even just that general overview of, like it says on the slide, the state of mental health right now, right? I think, if we share into that next slide, talking about like escalating mental health crises in the community and in the country, there's really been an increased awareness, thankfully, to the impact of mental health, and increased amount of resources to support. And I think even when we talk about eating disorders, as Noelle will get to, like we're seeing that start at a younger and younger age. And so really wanting to make sure that we're intervening to provide support to individuals at that onset, because in our society, even just thinking about New York, right? It's go, go, go. There's always the next thing that we need to be getting to, and always the pressure increasing for how we're accomplishing these things. And increase in, we'll speak to diagnoses that are showing up that are, indicative of PTSD, which is not just someone who's experienced trauma in like any type of military or first responder setting. It's a lot of additional sexual trauma and physical abuse and things like that that really do coincide a lot with eating disorders. And so we really do want to make sure that we're, connecting with people earlier on in the onset of their treatment. And it is continuing to escalate. Think getting into this, like speaking a little bit to the harmful norms of an eating disorder and how our society does present with a focus on body shape and size, right? And a lot of the difficulty, that's only one component of what can show up with an eating disorder, but it is becoming that much more prevalent of, even just looking at the statistics on this screen, 28.8 million Americans will suffer from an eating disorder at some point in their lives. Often we're seeing that begin, like we said, in those early teenage years, or even children that maybe even start out from that very young age with that picky eater, right? Like they're presenting with that, and it really can develop into a malnourishment in a state that makes it really difficult for them to provide their body the appropriate nourishment to continue to develop. And the 1/3 of these individuals ever getting care, which is a pretty stark statistic to think about. 66% of the individuals that are walking around in our community with eating disorders may never have access to care. And sometimes those are barriers there with socioeconomic status, sometimes with insurance awareness and coverage, stigma around reaching out for mental health. Like there's just so many factors that can impact an individual's ability to reach out and access care. So really, we want to raise the awareness to this and also increase the amount of offerings that we have for individuals to reach out for support. I'm going to pass it on over to Noelle now to kind of share a little bit about some of these truths that we have for overviews of eating disorders.
You're back.
Hi. Sorry about that. Eating disorders, right? So as kind of what Emily was talking about, it affects everyone, right? And we see that we're a Clementine program. So obviously we're treating adolescents. And Emily shared her oldest client has been 68. I believe that was the number you used. Yeah. So it definitely affects everyone. Sometimes also with eating disorders, because there's so many different types, people don't always look the stereotypical thing that you imagine when you hear someone has an eating disorder. With that being said, a lot of times, especially we see with our adolescent clients, the parents feel very responsible when the kids really struggle with the eating disorders, but it's really never the parents' fault. So we always like to say that in our treatment center. And unfortunately, eating disorders aren't a choice. They usually are triggered by a traumatic event. Usually we experience clients who have co-occurring disorders. So we'll see depression, anxiety, mood disorders. So we kind of will see that along with the eating disorder. And sometimes those things do trigger the eating disorder. And unfortunately, we also see that eating disorders can be a coping skill that people learn to develop for difficult times in their life. With eating disorders also, they are very, very dangerous. And I feel like that's not spoken about enough, due to not even just the physical part it has on your body and how it physically affects you, but also the mental health part, right? So it's very draining, physically, mentally, and emotionally. So it definitely does have an impact. And we also do see that with individuals who have eating disorders, who are able to enter treatment soon, we do see a better rate of recovery. Okay, thank you, Sarah. So again, just kind of talking about what I was saying before. So these are just kind of like statistics, but just to kind of talk about a little bit, eating disorders again affect everyone. They affect children. We can see children, unfortunately, as young as 10 years old who are struggling with eating disorders. And I think especially with society today and how, the new thing, Ozempic and all of these weight loss are glamorized, it's starting to impact people very young. Unfortunately, we do see it in male and female, but there is a higher rate of seeing it in females. And I think, again, a lot of that has to do with society's pressure to look a certain way. Again, kind of going back to the how dangerous they could be. So they are the second deadliest mental illness, the first being opioid overdose. We do see also that, unfortunately, every 52 minutes, someone dies as a direct result as an eating disorder. We also see Black or African American teenagers are 50% more likely than white Caucasian teens to exhibit bulimia behaviors, which again is a type of eating disorder that we will definitely get to in this. And Sarah, sorry. Okay, and Emily, yeah.
I was just gonna jump in on this part. I always feel like I
Yeah.
connect in with you a little bit. It doesn't have to be so formal and that I know Sandra was saying this is kind of like an informal chat type setting, right? And so
Yeah.
what you were sharing was so impactful. And I was even just thinking about not even just like society's expectations and standards around like beauty standards or what it means to be healthy or to be, fit or all the things like the beliefs and judgments that come alongside of that. It's also even certain types of like settings are more common to have individuals developing eating disorders, such as like performance type careers, right? Or sports settings as a teenager, it might start out as that priority to have the particular look that they need, whether it's a specific sport that they're involved in, or theater, or um, all of those different settings. And it might start out with, okay, this is going to help me improve and perform in this way, and then it becomes, okay, this is my identity and this is what I have to stay. And the fear can become so crippling of anything changing. And so I know, speaking more to like that adolescent impact, sometimes I've seen in the adult side that it starts from that young age, and it's a fear to ever become into an adult body because of all of the fears and associations that they could have with that. And so I think, just speaking to the prevalence of that and how early that can start, when I think about supporting our youth and even supporting relationships with others, we'll probably get to this a little bit more later, but focusing more on the attributes of a person's personality, right? And connecting with them and supporting with them as a whole person instead of fixating on like, wow, you did this, you look so great, or what was your secret? Like all of these things, because in reality, for a lot of people, it can be their secret is something that's actually really harming them. So we just want to hold space for that to try to prioritize the overall well-being of individuals instead of fixating on body shape and size as well, or even judgments around the foods that we're choosing, which that gets a little bit more complex. But just holding space for like that whole person, and not making an assumption, like we said from a previous slide, on somebody's initial appearance and judging that they may or may not have an eating disorder, because there are so many different types, right? There's not just, okay, this is the restricting type. They look like they lost a lot of weight. They look like, unsteady. Well, it might be somebody who really struggles with binge eating, right? Or somebody who really struggles with the art. Well, sorry, I didn't mean to jump into that, but I guess it leads us into that, which is perfect. Just thinking about like all the different presentations of this, like there are so many different types. You never want to make that assumption that somebody does or doesn't have it just by what you're seeing on what their body looks like. So when we talk about some of these diagnoses, I'm not going to read fully through them. You've got this to pause your screen, read through it at a later time, whatever that might be. But we do look at anorexia nervosa. There's a couple types with that. There's the restricting type, where someone is severely limiting the amount of intake that they have throughout the day. And then there's also the type that's the binge purge type, right? So then it might be an onset from restricting throughout the day and then being so hungry at a later time. And it creates this habit of, binging a high amount of food at one time and then feeling that guilt and shame for that and engaging in that purging behavior. You may see clients who have that bulimia nervosa, or individuals or peers, supports, friends that are strictly engaging in that purging behavior and not so much necessarily limited to a restriction or a binging as well, but that compensatory behavior of engaging in that purging. And when I think about purging too, I do want to be very clear that purging is not just engaging in like vomiting, right? It might be purging through other aspects of laxative use or even over exercise, compensatory, compulsive exercise behaviors to purge those calories that they ingested. And so I just want to be mindful that there are various ways that someone might go about that. Binge eating disorder, this can involve rapidly consuming a large amount of food in short periods of time. This can often be connected with difficulty with maybe a history with trauma. Also, emotional eating, right, can come up that can feel really hard and lead to an excess of intake, with a lot of these diagnoses having a disconnection of somebody's mind and body, right? Like they are really struggling to bring that into an awareness to themselves and honor what their body is communicating with them and work through some of the mixed messaging that are coming up as well. The next slide for additional diagnoses is also what we call OSFED, the other specified feeding or eating disorder. And this can be where someone doesn't quite meet the criteria for one of the eating disorder diagnoses, but they've got pieces of multiple connected, and we're seeing a lot of that interaction impacting them. and the avoidant restrictive food intake disorder. So this one we're seeing, I mean, I can speak to my site specifically. I'm not sure for you, Noel, but I'm seeing this much more often. It can be connected with, again, I mentioned earlier, like that picky eater as a child that really had a hard time expanding those horizons. And or it could be someone who has a really difficult time with taste or texture or smells and or a really traumatic past experience with a certain food or an allergen, and then it leads to this intense fear of that exposure, and so it feels safer to remove so many items. What we see with RFID is there's not often ever any type of focus on body shape and size, which we would often think can be connected with eating disorders. It is really focused on that avoidant and restrictive intake with specific foods for other reasons. So not sure, Noel, if you've seen more of that on like the adolescent side, but I'm seeing it. It used to be if we had 14 clients, I would see it for maybe one or two of them. Now it's becoming closer to that third mark, or even someone might have another diagnosis, but have a lot of those ARFID tendencies connected.
Yeah, definitely. I mean, for the adolescents, we are, like you said, like we are starting to see it a lot more frequently, interesting enough. Something just to note too that we are noticing, we have had some clients who are on the spectrum, and sometimes individuals who really struggle with texture, like we said, right? Like textures, taste, any of that stuff, we are seeing almost as if they are developing ARFID because of that.
You want to take us away on this, or I can jump us back into, some of the causes here if we want to speak to some of that. I think I'll just start us off by sharing that, we talk about what causes it. And I know Noel touched on it earlier of, it's not just this one thing. Sometimes genetic predisposition, sometimes a history of trauma, sometimes a current other co-occurring diagnoses, such as a client or an individual who's on the spectrum that has some of that neurodivergence happening that impacts how we're engaging with food. It can come from a lack, right? If they've had food insecurity in the home over time, like that can impact that poverty mindset as we approach the food, which could make it harder to allow themselves to have the food, or when they are faced with food, then really not know how to navigate like that need to make sure that they're having all of it because they're not sure when it's going to come again, right? So that can really create habits. And again, just a lot of these other factors. It's not just one area or the other. There's so many impacting factors.
Yeah, and I will kind of speak a little bit more to the adolescents and, what causes an eating disorder, what we're kind of seeing with the kids. Definitely the social and environmental component is huge for us. So a lot of times, the peer and even, these kids are at an age where they're starting to date. And unfortunately, we are seeing, when a friend or a boyfriend or girlfriend, are making comments about their physical appearance, these kids are really, taking it to heart. And unfortunately, it is triggering an eating disorder because they are unhappy with it. A lot of times, too, in certain cultures, you're expected to look a certain way. So some parents don't even realize that, they're putting these negative thoughts in their kids' heads about, looking a certain way, and again kind of causes the eating disorder to start because they want to meet their parents' standards. Family circumstances too, right? So I know Emily kind of talked about it. We see a lot of kids who come in here for treatment and they have a close relative, a parent, a guardian who also have an eating disorder. And, they grow up seeing the behaviors and how they, are around food. And then unfortunately, that is kind of like their norm. That's what they think is okay. And then it develops into an eating disorder. Definitely too, like with the kids into the psychological part, that's a huge part too. Um, Unfortunately, again, the world we're in today and how big the online presence is, and how people of a younger age, adolescents, teenagers really depend on like social media and things like that. If people are bullying them online or making comments about anything that they post about their body, these kids are really taking it to heart. The low self-esteem definitely starts. Again, like I said before, sometimes these kids experience unfortunate life events or trauma, and really use the eating disorder as a coping skill. And that's just like how they are dealing with their negative emotions, unfortunately. Um, but yeah, Emily, I don't know if you want to share anything else related to the adults.
Yeah, I think something I would add to that you really started to touch on was how impactful traumatic experiences can be with the development of an eating disorder. And again, this is where there's those overlaps of those circles because we've got that social and environmental impact with relationships. And then it might be, okay, this helps provide me some level of an outlet. I've got some control over something when everything else is feeling overwhelming, everything else feels out of control, and it feels too hard to tap into those emotions of the experiences and process what actually happened. Let me focus on this instead. And then it becomes something that is so difficult for someone to take a step back from the just how do I numb out? We do talk about it being a coping skill, right? It's a maladaptive form of coping, though. It's helping them distract or have another focus, but really not helping solve like the root issues of what's coming up and going on for them. And so, even within Montanito, we do a lot of values work to identify like what is important for them and how it does feel like this eating disorder is serving them. Like this is providing something for everybody who has it. It might be safety, it might be control, it might be that connection, that sense of identity or love. Like there are so many factors that lead to the development of an eating disorder. And then especially when I think about that trauma piece, we are very intentional. At least I think 50% of the individuals that we've had come through the door, and that may seem like a really high number, and it's pretty accurate that they've experienced some level of trauma in their history, and often it is so intertwined with how they engage with the eating disorder too. So, touching on this one with signs and symptoms, we started talking about some of these emotional and behavioral aspects, right? Like that fixation on their body shape and size, their weight, judgments around foods that come up as being this is good or this is bad, which really ties into I'm good or bad if I have these different types of things, right? So then it creates rules around when I'm allowed to eat, what I'm allowed to have, what does it say about me if I'm so like I have such strong will or discipline to stay away from these things, and it really develops into the eating disorder. But we also see a lot of the physical factors that might not be so evident when you're looking at somebody. Some of them might be obvious, right? Somebody might have that lower weight, that low muscle mass. Internally, someone especially who might struggle with that purging behavior is going to possibly have those dental issues and decay. We're looking at kidney damage, right? Dehydration, other deficiencies, and long term, it can cause even bone weakening. And so we see some where we see the osteopenia where that can be reversible with that appropriate nourishment. And so we really want to be able to intervene at that sooner time. But some clients who have been experiencing this for a number of years, it does end up developing into that osteoporosis. And so it can lead to really long-term impacts that aren't just, when we see that slide from the beginning of every 52 minutes, somebody passing away from an eating disorder. Like, yes, that is really serious. And there are so many other factors that happen before they get to that point that for me, I view that as an opportunity to intervene, right? There are so many signs and symptoms along the way that if we just educate ourselves about them and we are on the lookout for that with our loved ones, we can help provide that support much sooner so that they don't have to become another part of that statistic.
I think,
Um,
oh, go ahead. I was going to say, I think we talked a lot about the co-occurring, but go ahead. I just want to be mindful of time.
yeah, of course. Sorry. I was just going to add to the last slide with Emily. But totally fine. Okay, co-occurring disorders. So again, I already touched on this. So most common, we are seeing anxiety, depression, bipolar, OCD, ADD. So we are also something important just to note about Monsanto, when our clients are in treatment, adolescent or adults, we are not just addressing and treating the eating disorder. It is so important for us to be addressing the co-occurring condition as well, because we feel if we are only treating one part of the problem, we're setting them up for failure when they leave here. So one of our treatment approaches is definitely addressing, any additional diagnoses like the ones listed. And that's because we want to set them up with the best possible chance of recovery. So we definitely work on all of that. And then just to touch on the other side, so I know we've touched on this so much, so I'll be super quick. We, of course, unfortunately, do see such a high rate of trauma, sexual abuse, physical abuse, emotional abuse, neglect in children, which really correlates with the eating disorder. And I know Emily touched on it, but at least with adolescents, we are seeing the eating disorder is definitely a coping skill, but also they feel so out of control with their life. They aren't in control of any aspect of their life. And that is just what they feel they have control of. And unfortunately, they really lean into that.
All right, I'm gonna chat a little bit about Montanito. I feel like it's delayed when I click this, so I apologize. Um, I can just say here, recovery is not linear, as it says on the screen. There are going to be lots of ups and downs for those that are struggling with an eating disorder and all types of eating disorders. And that's okay, right? With any sort of mental health, we know that there's going to be ups and downs, but that full recovery is truly possible. It just takes a different amount of time, potentially, different ways of approaching what's going on. And we have found at Montanito that when you ensure that somebody is going through the continuum of care, meaning if you start with us at residential, you step down to our PHP level of care and then step down to our IOP level of care, and then continue having community support with outpatient therapists or dietitians, family support, and all the things we talked about before. Um, the recovery outcome is just a lot better because you have that full support and it's not so secretive and it's a full system. Just wanted to share that. As I mentioned before, and we've oh, go ahead, Emily. Did you want to say something?
I just wanted to share one brief thought with that when you were saying that we do
Yeah.
believe that full recovery is possible at any time. Like, I think something that's been really special about our site is that we often will have people who are fully recovered from an eating
Mm,
disorder who end up stepping back into the field to provide that support back to others who are struggling. And we end up having quite a few like fully recovered staff on site that are here and able to support the clients. One of their
yeah.
favorite things is to request having recovery panels because they get to hear from people who have gone through it, and to hear kind of what about their journey and how they got there. Because oftentimes someone who's in the thick of it struggles to see that there could ever be an end in sight. So just holding that space, like I think that's something really special that, we're able to offer individuals on site.
I love that you said that. Yeah. So again, coming back to Montanito and the levels of care that we offer. Inpatient level of care under the Montanito umbrella, we have walled-in behavioral care. They have an inpatient, residential, PHP, and IOP, mostly in like the Connecticut and Massachusetts area. That is for more medically complex, kind of what we were talking about before. Those individuals that their eating disorder is a little bit more acute and need more medical attention. Below that level of care, we have residential care, which is where Noelle and Emily are supporting. It is 24/7 support in a very home-like environment. So the homes that we treat our clients at for residential care, if you pass by it, you would say, wow, that's a really beautiful house, right? It is not meant to feel like a hospital or clinical. While a lot of clinical work is being done while our clients are with us, it is a really safe, nurturing, supportive, bright space that is really intentionally designed so that our clients can feel comfortable when they're there. And then stepping down from residential care, we have our day treatment programs. Actually, before I jump to day treatment, I will say at inpatient and residential, the amount of care that is happening ranges from medical oversight, work with a psychiatrist, work with an individual therapist, work with an individual dietitian, family work, family support, psychoeducation for family members, even if they're not the ones that are our clients. We want to educate them so when their loved one comes home, they are ready to provide the support that they need. Um, a lot of group work is happening at our sites around body image and processing after a meal and all the important tools and skills, DBT skills, right? All the important things that are needed for that journey and for that treatment. Nursing care, 24/7, recovery coaches, right? I'm kind of listing all the things that we have at our sites that are really implementing a lot of structure and a lot of support because that is really what is needed. And then stepping down to day treatment. So day treatment, our clients are living at home with their family or their loved ones and coming to us for PHP, which stands for partial hospitalization program, though it is not in a hospital. For really like what you would consider like a working day, right? Sometimes 9 to 3:30 or 4, depending on the program. We have a PHP and IOP site in White Plains, in New York City. So depending where you're living, we would support you in finding or a client the most local site. And and again, it's kind of like a step down, so it's not as intensive of care, but still the same elements of what I was talking about for residential. And then IOP is even less hours, so typically, after school hours or after work hours. So clients can be immersed a little bit more into their typical daily life, but still getting the care that they need. And then additionally, an IOP program, if appropriate, where a client is able to connect and engage virtually, or they don't have access to an in-person site. Like I said, closest one is White Plains, and they're 2 hours away. That's really long commute for every day, right? These PHP and IOP programs are 5 or 6 days a week, maybe 4, depending where you're going. And so that's a long commute. So we do offer virtual care at that level. And then afterwards, we are making sure at Montanito that we are supporting in finding the right outpatient care as well. So finding a therapist who specializes in eating disorders or a dietitian or a psychiatrist, and just kind of supporting in that continuum of care. Did I miss anything, Emily and Noel?
No, I think you hit it. I think I'm sure you'll probably I think we took this one out, but we have sites across the country and like I think it's like 17 states or something. I could have that number wrong, but thinking about, this is great and we're talking about this area specifically, right? But if you all have family or friends or people around the country that are also in need of support, whether we have an in-person location in that state or not, we may also be able to provide services virtually. And so are continuing to expand. And so I think it's really important to note that like we want to help individuals remain in their community and with their team and be able to continue to exist in their life. And at times we might need that specialized focus of being able to step out into some of these other more intensive settings to really interrupt the patterns.
Yeah, love that. And then oh, Noel, we were going to say something.
The only thing I was going to add, just about residential level of care for adolescents. So we are starting at the West Nyack site to do tube feeding, which I feel like is just important to say because not a lot of programs at a residential level offer that. Of course, when people are in the hospital, it's offered, but we're going to be doing it at West Nyack. That was all, Sarah.
Aspects. Did I freeze? I think I froze for a second. Sorry. Some additional virtual programs to share because these are some specialty programs. What we were talking about before, right, around certain diagnoses, really trying to specialize in some of the treatment that we're doing. So you'll see here some virtual IOP options that I just want to mention. There's our general adult and adolescent PHP and IOP. We have our IOP that is specifically for binge eating, which is free to be. So it is, an IOP just for that diagnosis. We have one for ARFID for adolescents. So really working on a lot of exposure work and specifically, targeting the ARFID diagnosis and really incorporating the family and caregivers in those treatment sessions. And then lastly, this says PHP on here, but it's actually just IOP for right now. It's our LGBTQIA plus program. So those individuals that identify in that community and are also struggling with an eating disorder have a really unique opportunity to come together and kind of support each other and talk through very specific intersection of how they identify and the eating disorder. And many of our clinicians in that program are also identifying in that community too.
Yeah, I'd also just add to that specifically with the Rainbow Road program, or even just that intersectionality of identity and being a part of that community. There is quite a high prevalence of eating disorders just due to any number of challenges, including like any type of like gender dysphoria that's happening and how that desire to control the body's shape and size can lead to the eating disorder. And so it is a very unique way in which we as clinicians support clients who are struggling with that.
Yeah. Yeah. Um, do you guys want to chat on this one? Or we may have kind of talked a lot about this already. We can skip. Yeah. Um, Emily, I think you were going to chat on this side.
Yeah, I think it's really important to note this because I think when we were going back to, eating disorders comes in all shapes and sizes. And so just not wanting to, we don't endorse controlling a body shape for the sake of like weight loss in our settings because that further perpetuates for a lot of people that a belief that their body is wrong or that they can't be healthy in any different size. And so we do hold what's called the HAZE approach, which is health at every size. We do recognize that there are so many factors to a person's health, right? Their mental, emotional, physical well-being, that's lab work, it's, all of the things that impact their overall health and well-being. And so we are looking at, the importance of making sure that we're weight inclusive. And then we do make that argument to support our clients with insurance companies that might have a hard time with having more of that understanding of how eating disorders can impact people of all body sizes. And so we really do advocate for that support for clients, like it says, regardless of their BMI. And we're always going to support clients through the difficulties that come up with acceptance of themselves in any, wherever their body would naturally, we talk about it, finding its happy place, right? Like when we're not exhibiting control over our body shape and size, and we're not also engaging in behaviors that are impacting that negatively. Like, let's talk about how do we just honor and work together with our body with where it is. And so that is a really important part. And when we look at this, we have clients it's over 50% for adults and adolescents that are at normal or higher weight that do meet criteria on admission with an eating disorder. And so it's not always that stereotypical presentation that we expect.
I was just going to add really quick because I meant to say it before, but we are in network with pretty much all major commercial insurance companies. So, our care is covered. And we always will run a verification of benefits to kind of determine, before you admit to our program. So you'll have all that information. Um, Just thinking of time, we have about 10 minutes. Do you want to like quickly talk about this? And then I think we're almost done. Yeah, these are additional resources. And then I think it's just my contact information. Do you want to share?
Noelle, you want to jump in on that, or would it be helpful if I did? I'm good either way.
Yeah, I mean, we could both jump in a little bit. So of course, with an eating disorder, what we're doing in residential treatment is our approach is not to, specifically introduce any types of food, right? We're just trying to reintroduce food first. So that meaning when our clients are here, we're having them eat all different types of food. And that is really just to not only, of course, help with the eating disorder, but it's almost a form of exposure therapy. So having them step outside their comfort zone to in a controlled environment so that if it is challenging, they have the clinical support. We do also talking about like repeated meals and snack exposure. We do challenge meals. We do challenge snacks. We sometimes we will repeat meals. We will also, I'm sorry, they're doing the landscaping right outside my office.
It's okay. I don't think we can hear it. At least I can't. So you're all right.
Okay, good. Emily, do you want to jump in? Sorry.
Yeah, no, it's okay. I think
It's
what I
so
would just
loud.
add with that is like we are with the nutrition, like we do talk about like all foods fit, right? Like not demonizing or glorifying any type of food category or any particular item. And we do want to make sure that we're providing holistic meal support and snacks. We think about, at the residential site, we are having all those meals and snacks on site. However, once a week, we're going out to a local restaurant and we're having that exposure together with clinical support so that we can start to integrate more into the community and work on normalizing getting back out to restaurants because sometimes that can be really, really difficult for someone who's got an eating disorder because, they've created so many rules around how they engage with food. And there can be so many unknowns about going to a restaurant that can feel really overwhelming, or out of control. And, along that journey, as somebody is progressing through treatment, we might set them up with going out on a snack pass with their family or going on a dinner pass with a friend. And so things like that to help practicing the behaviors that they're working on challenging in our more structured setting to start having these exposures again in the community and then coming back and working through that. And so, again, we do have the individualized meal plans as well. That's because everybody's coming in with different needs for their body and different things that need to be supported. And we are looking at everybody as an individual person. We may have the general meal structure of the facility, and your meal plan is going to be what's appropriate for you. And so we do make accommodations as well. I do want to recognize, at least at the New City site, we also are kosher accommodating, right? And so we have a whole part of our kitchen that is more supported to help somebody who does observe a kosher diet. And so with that, we are able to support more of like our community who observes in that way.
Great, thank you. I want to share. I froze again. Sorry. Um, these are some additional resources that please feel free to take like a screenshot of these resources. They're really, really wonderful. Feast is a really great organization for parents and caregivers. If you ever need to find care, and these are great organizations to look through their website and kind of find other resources through them. Some of them offer scholarships for and yeah, they're wonderful. And then this is the last slide. This is just how to get in touch. This is my direct contact, my email and my phone number. If you ever have a question about what to do, about, should I seek care? Should I, does this person, feel free to call me. I can always also put you in touch with Emily and Noel. I didn't put their email address on there just because they're on site all the time. So I'm happy to kind of facilitate. We also have an admissions line. You can call the admissions line, or you can go to our website at montanito.com. But we're happy to answer questions. I hope this was really helpful to learn more about eating disorders and just what we do specifically at Montanito.
And not just helpful, but entertaining as well. I love the landscaping background. Although we didn't hear absolutely anything, Noel, I have to tell you, it's like crickets.
Okay,
So,
I'm glad. It was so
yeah,
loud in
no
my ears.
problem. We have a question here from one of our attendees. Do you observe halal?
Yeah, go ahead, Emily. I was going to say we certainly observe, we make all accommodations for any religious purposes or dietary needs. We will just, not this is not the answer for that question, but many times dietary restrictions, we want to make sure that it's not the eating disorder, but absolutely any sort of like need around religion or, you know, um, what's the word? Allergies or anything like that. We certainly, but Emily, I
Yeah,
don't know if
we've
there's something
had
else you want to say.
multiple clients on site who are halal, and we are able to support with that type of meal plan.
Mhm. Another question. The patients that go to one of your facilities, do they have to go like free will, or can I, as a parent, say I need my daughter or my mom to be here?
So that is a very good question first. So yeah, I mean, honestly, we do experience that where the parents really want their kid to seek treatment. Sometimes we see our kids are resistant to treatment. Of course, adults, it's totally voluntary. For the kids, yes and no, right? Because they have to agree to engage in treatment, but parents are the ones who really get the final say in it because they are minors. Um, when a client is supposed to be coming in and they are very resistant, we do everything in our power to make them comfortable. We do offer tours before we even admit clients so they can kind of get a feel for the program and what it looks like, get them more comfortable. So yes, we do experience that, but
Mhm. And what's the longest that a patient can stay at one of your homes?
So typically, on average, we're seeing clients stay with us somewhere between 5 and 10 weeks, I would say. That is a large range, but really because it is so individualized, and then making sure that they are prepared and ready to step down to the next level. Insurance sometimes plays a role in that conversation too, but our team will certainly, when we feel like they're not ready, to step down, we'll talk to the insurance company to try to get some more time and at each level of care.
Okay. We're reaching the end of this presentation. And again, when we talk about eating disorders, we never have enough time.
Mhm.
But do we have any eating disorders? Because every time that we think about eating disorders, we think about losing weight, right?
Mhm.
Like the binging, the anorexia nerviosa, all of that. It's always lose weight. Is there an eating disorder where the person wants to be larger and larger every time?
So I can jump in on, I've seen a couple different aspects where either someone is intentionally trying to control their body shape and size, and it is in a perspective of gaining weight. And I've seen some where like the engagement, when we look at a binge eating disorder, where they're not engaging in any types of behaviors to purge that intake that they've had that will result in weight gain, more often than not. However, when I think about, I also want to support and address that person who is trying to control their body shape and size with weight gain. I specifically can recall a client that we had, at one point that was controlling that for the sake of gender identity, right? And so we want to make sure that we are supporting, like, how do we support you in owning and living in your identity without having to exert this control over, this is the only way that I'll be able to be confident in that way. And so we do see that with how people might engage with food inappropriately. And so we support with any of the number of reasons that are leading to that.
And my last question is, do you offer any psychiatric support as well for some of these patients?
yes, so each site has a psychiatric provider. So when clients are admitted, they'll initially meet with them within 48 hours to do an initial assessment. And then also they are meeting with them weekly or sooner, depending on like if a client is in crisis or experiencing SI or SH, our psychiatric provider will step in at that point and meet with them to see what's going on.
Okay, well, thank you so much, not just for the presentation, but also for answering all these questions. It was very informative, and welcome to our community. And I'm actually also thankful that you are here now for this population. One last question that just popped up here is, do you have patients who use laxatives to lose weight?
Simple
Yes.
answer is yes, all the
Yes.
head
All
does.
around. Yes.
And
All the
that
head
kind of
nodding.
that brings me
Yes.
back to that point earlier when we touched on like purging shows up in various forms, right? Someone might not just be doing that by engaging in vomiting. It can be through laxative, it can be through overexercise. And so that is definitely one of the aspects that when we have a client coming into our treatment settings, we do ask them if they do engage with using laxatives as well.
Mhm. Well, thank you, thank you, thank you.
Thank
Wonderful
you
each
for
one of
having
you,
us.
and for this great presentation. And hopefully, I want you to do well in Rockland and have business, but at the same time, I don't. So
We
I don't
say the
know how
same
to
thing.
express this,
I know, we say the same thing. We are
right?
here if you need us. We hope that you don't need us, but we are here if you
Yes,
need us.
exactly.
Yes.
Like
Yeah.
I'm really happy that you guys are here, but at the same
Yeah.
time, it's like we just hope that because people die of eating disorders,
Yeah.
and this is very challenging to treat and very serious.
Mhm.
So thank you
Yeah.
for being here for providing these services too. Okay.
Thank you. Thank you.
And next week in community chats, we're going to talk about something related. And they mentioned that picky eating. So if we want to prevent a lot of these eating disorders, we have to start early in life. So next week, join us in another community chats to see how we are going to do that. Thank you, everyone. Have a good afternoon. Bye-bye.